I grew up in Salisbury in England, which is a small community about 90 miles southwest of London. My father was in the British Army and there was a big military base there. I was a generalist student, graduated from university and was looking for an initial position that I felt would give me some very good training that I could use later on in life. So I got into finance. An opportunity came to move to New York City, so I took it. I met a fantastic lady, my wife Nell. She's Australian, she was in the big city doing exactly the same thing, and 25 years later, we're still here. I started my career in banking, and the opportunity to join Deloitte came along. Back then, it certainly had the brand and reputation of being an accounting firm. I felt intrigued by what the firm was doing, and certainly 18 years later, I couldn't be happier here. I'll relay a personal experience that had a profound impact on my wife and myself and our family. My wonderful boys, Luke and Jason, decided to join us in this world very, very early. They were very premature. And during that process of seeing them in the NICU, how the doctors and nurses engaged with them was truly life-changing. But we also learned about some of the massive inefficiencies in care. My young boy actually went off our health insurance very, very early and was paid for by the state. Because if we'd paid for him, it would have financially bankrupt us. There's access to the equipment, there's access to the nurses, but if a nurse doesn't turn up on time, you're by yourself. If the equipment doesn't arrive on time, what do you do? So as a health professional in the healthcare space, I can talk about the utopian future, and I can also talk about all the barriers that prevent it from being realized, the practicality of it all. But my goodness, when it impacts family, friends, and relatives, rationality goes out the window. And you just want them to have access to the best. And so I think I bring that to my healthcare clients by really helping them think through the financial implications of the decisions they're implementing, the solutions they're implementing, how they're delivering care, how they're bringing care to their customers and patients. I do bring a very financial lens to that. I'll go back to my own personal experience. Here we have 2 6-month-old kids at home, and both of them needed physical therapy, speech therapy, occupational therapy, some medical equipment, some monitoring. And so then you start piecing together, who do I need to engage with to make all that happen? My wife ended up having a degree in computer science just to figure out the Byzantine regulations to get access to all that care. And she stopped working, so she was able to do that. So many people don't have the ability to do that. There's no one organization that's going to provide the therapists, the nurses, the medical equipment, the follow-up, and focus on food. Can they afford to do this? So you start seeing that it's an incredibly complex number of different players that we need to bring together to really drive the best possible outcomes. Platform health and creating partnerships between different organizations. At Deloitte, we've been spending a lot of time thinking about health equity and social determinants of health. And with this business model around platform health, we're redefining what is health. And that's what platform health is about. It's trying to say, hey, let's expand the definition of health. And then how do we piece that together? The smartphone can be used to detect certain healthcare conditions, both physical and mental. And we can do that almost in real time. It's products, it's data, it's thinking about ourselves differently, not just sickness, but holistically in health. Because if I can get the right data, I can start thinking about preventative care. I can anticipate when a heart attack is going to happen. And if I can do that and get ahead of the condition, I can work with the individual to maybe prevent it from happening in the first place. It makes the industry incredibly personal. We all will need healthcare at some point in this journey of life. And so it brings it all home.